Thank you for staying with us. Let's bring you this now. Coronavirus variants first detected in India and the United Kingdom have landed in South Africa. The Network for Genomic Surveillance says that cases were confirmed in the Western Cape, KwaZulu-Natal and Gauteng provinces. Now, this has raised fears that the third wave may be difficult to manage, but Health Minister Dr. Zweli Mkhize speaks to us now and gives clarity on some of these concerns. Minister, thank you so much for your time and a good morning to you. I suppose my first question to you is, should we panic? Should we be fearful about some of the variants with which you've detected in South Africa?
I think we should just be vigilant. When it comes to the variants that have been detected, we have one that has been detected in UK, and we've got 11 cases there. And then we've got the one that was detected in India. We've got 4 cases there in Gauteng and in KwaZulu-Natal. We've got another case detected in South Africa, but came with someone who came from Bangladesh. So it does tell us that we have the introduction of these variants coming from different parts of the world. Our biggest issue is that we don't know how they would behave in South Africa. And therefore, we focus on the fact that everything needs to be done to limit the spread of both the new variants and the pre-existing ones in South Africa.
Minister, I just want to start with the variant that was first detected in the UK, namely the B117. I understand that there are community samples which suggest that, there's already community transmission. What does this then mean in the broader scheme of things, and also what's the department's intervention thereof?
Well, once someone comes with a variant from any part of the world, or if they've got the infection, the risk is that the immediate contacts of that individual will be affected, and therefore to start seeing a community spread. So we have to just focus very strongly on the issue of quarantine, isolation of the individuals who are infected, and also ensure that we do contact tracing to limit the spread of whatever has been discovered. So that's what we're intensifying on all these cases.
And also when we speak about, the other variant, the B.1.617.2, this is the one variant first detected in India. I understand there was contact tracing there. 4 cases detected in South Africa. Subsequent to that, there was contact tracing. Is there any reason to believe as a department that there might be a spread of this particular variant outside of the 4 already detected?
There is a risk of a spread for any one person with a contact with people. The risk of spread is always there. I think we must work on the basis that any of these can spread, and therefore, whatever work we do is about trying to limit the extent to which this could be spread. So it won't be surprising us if this is spread to other contacts of the individuals, but we must be aware as well that it would have been difficult to completely isolate South Africa from any of these variants coming from different parts of the world, because people move at all times, and some of the countries which we have got a very close relationship with would end up with individuals visiting us or our people visiting that side, and therefore coming back with an infection, even if it was not detectable at the time of their entry into the country.
Right. And I suppose, Minister, I'm asking these questions because when we look at some of the images and reports coming in from, countries such as India and the UK, we're seeing that both countries are quite, struggling and grappling to contain the virus. My question to you as a department is then that how deep is the threat in terms of these variants of concerns?
The threat is as bad as what we would have with the variant that we have in South Africa. The reality is we have to prevent more people getting infection in South Africa, irrespective of the source of the variant. We have seen how we had no introduction of any variant from somewhere else, and the variant in South Africa really caused us huge harm in the past wave. And so we have to be very, very vigilant that the detection of any new infections and any new variants needs to be done fairly timeously so that we can limit the spread. So the risk that we have is that any of these variants can behave in a manner that we cannot predict, and we can only know once we've seen what they've done. So what is important is that to prevent the spread of the infection, whether it's a South African infection or whether the variant that's found in South Africa or in India or in the UK, the people in South Africa need to know that the containment measures are the same. We have to use our mask. We have to ensure that there's sanitizer, hand washing and sanitizers, and we have to make sure that we avoid long queue, congested queues, and avoid people being involved in overcrowded situations where there's no protection. All of this has to be done because irrespective of the source of the infection,
right,
we have to actually contain all of this. It doesn't matter which variant it is. We are worried about variants that are coming from outside, but we're also more worried about the one that we've got in South Africa as well.
So then, Minister, speaking of containment, how far are we as a country and as you as a department in terms of the vaccine or the vaccination rollout program and campaign, specifically when we look at the Pfizer vaccines which are expected in the country?
There has already been the first batches of Pfizer received last week. Last night, we also were supposed to receive another batch, but effectively we'll be receiving them every week, over 300,000 of them every week for the next 2 weeks, and then after that there'll be about 600,000 every week. We're still pushing to get more than that coming between now and end of June. So we have got these vaccines taken to quality control, and that should be concluded so that by the 13th or 12th and 13th, they must start be distributed to the different provinces. So we expect that the should vaccination be resumed on the Pfizer vaccine from around the 15th. We're going to be focusing on the health workers at that point, and then of course on the 17th we will need to be opening up for phase 2. So that is on course. We're still expecting as well that the Johnson & Johnson should be released anytime. We'll be aware that the Johnson & Johnson vaccines were already manufactured, packed, and ready for dispatching from Gqeberha in Port Elizabeth, but they were halted because the audit was going on in the US, and whilst that was going on, together with in Europe, then they actually asked us to wait until they conclude that. This is just really a safety precaution because we didn't believe that our vaccines would in any case be affected by some of the problems that were detected in the USA. So once they are done with that, they should be released. So 1.1 million is expected to be released anytime, probably late this week or next week. We'll hear how far they're gone.
And with that being said, Minister, because I understand that the halting of the J&J vaccine, almost suspended reaching your target for herd immunity, as well as, vaccinating healthcare workers, then coming on to senior citizens. But in terms of reaching those targets and, deadlines, how far are we as a country?
We are estimating that some provinces will complete their targets by end of the year, but others will actually spill over into the first quarter of 2022. So we're still hoping to get as much vaccination as possible, so that by from the 17th of May to the 17th of October, we should have been able to vaccinate 16 million people. And then beyond that, we have got a target of about 22 million people from October towards the end of the year and early next year. So we're still holding on to those targets, but we do realize that there will be a spillover until 2021 because some of the provinces won't be able to conclude their vaccination by this year.
All right, Minister, we thank you so much for your time. We'll leave it there. There was Health Minister Dr. Zweli Mkhize.